Hi everyone, this is Dr. Virginia Ellis over here at Virginia H. Ellis DDS Dental Corp. Website address orindadentist.com. Today I am going to be answering questions about children's dentistry, children's dentists. Before we move on, go ahead and click the like button, subscribe to the channel, and share the video once you're done with someone who could make great use of it. All right, here we go. Dr. Ellis, what is children's dentistry or pediatric dentistry? It's basically a specialized dentistry for children. And usually a pediatric dentist will have had years of extra training in treating children, mainly to treat children with advanced medical conditions. They're also trained in treating children with emotional or psychological or psychiatric conditions that requires extended training to be able to deliver the dental needs that the child needs, okay? Next question is, why is it important for kids to establish good dental habits and have good dentistry experiences early in life? Because number one is you avoid disease and pain. Number two, these children will grow up as adults feeling comfortable to get treatment in a dental office. Most of the adults that I meet that have dental fears stem from childhood or bad experiences in dentistry. So it's important to come in early to make sure that you have a positive experience for your child so that when he or she grows up, this person will not have or will be less likely to have dental phobias or dental barriers to getting his or her teeth treated. What should a child's dental routine consist at home? Basically, a dental cleaning at home, your daily dental cleaning. Start flossing as soon as you can. Some people, parents think, oh, they don't need to floss because they got baby teeth. No, you do need to floss those and brush the teeth. The other routine is don't get into the habit of having chewable vitamins because they get stuck in the teeth. I don't recommend that, okay? Liquid vitamins. So our routine is don't have chewy, sticky foods. Brush your teeth every day and floss. Just have them watch you brush and floss the teeth. And bring them to the dental office and have them watch their older siblings get their teeth cleaned, or have them watch you, because when they see you and you're not scared or you don't have any barriers, they will come in and they will be really good patients, okay? Have them become familiar with brushing teeth, show them videos, read them books, and have them watch you, and they will have a really good attitude towards brushing teeth themselves. When should a child have their first dental appointment? That is a great question, okay? It used to be recommended by age 3, not anymore, okay? That stopped a while ago. Usually by the first couple months after the first tooth erupts, or by latest age 1. Yes, by latest age 1. And it's not to do a bunch of work. Hopefully you will not need to have your child get treated for dental work at that age. The reason is to do preventive dentistry. So to teach you guys how to brush the teeth, what to feed your children, and how to prevent disease. Okay, what habits to stop, like the binky, the pacifier, if you have a question about thumb sucking, and just the diet, not putting your babies or toddlers asleep with juice or milk in the bottle. That's not good, okay? That is my practice. Dr. Ellis is make kids comfortable during a dental appointment. You know what? That's a great question. The one thing I do that's different from other practices is I make them feel comfortable in the office first, okay? Sometimes they won't come in here and get everything done at once. It's just not realistic, because when you force an issue, the child's first experience is so new to them. They're coming in here, they're opening the mouth, you're sticking all kinds of stuff in there. They're going to freak out. Some kids are good, but you have to make them familiar with the environment. So I will have a lot of kids come in, say hi, meet the staff, grab a toy, bye, show them a toothbrush. Sometimes it takes 2 or 3 visits. It's just, I call them my happy visits, okay? And then by the time they're ready, they can open up, take x-rays, and get their teeth cleaned. So it really is about making it comfortable and familiar. I will have a child become familiar with our office and the staff. That way, when this little kid comes in, they're comfortable, they're more cooperative, and they want to come back at the next visit, okay? So in my office, I don't push it. I have them come back. If they need to come back to get to know us better, I don't charge you extra for that, because for me, that's so important, okay? It's very important for a child to become familiar with the office in order for us to be able to deliver care in a comfortable and loving way for the child, in a positive way. What dental issues are most common among children? Well, obviously cavities, okay? The most common thing I see is cavities and the molars. Let me see. I'm going to grab the models here. Cavities, here we go. Here's like a model here. You can have cavities on top of the molars of the baby teeth, okay? And usually it stems from eating crackers or vitamins. Chewable vitamins are my number one reason for these little kids getting cavities on their molars, okay? And obviously, if you're not flossing in between the molars, you can get cavities there. But that is really a common problem more than anything. Why would a dentist recommend a root canal or pulpotomy for a child? Okay, this is a great question. We would recommend a baby root canal when a cavity has been really deep and it's now reached the nerve, okay? Once a cavity has reached the nerve, you can't just put a filling on top because the bacteria will explode. It'll really just spread, and it'll spread to the bone, and your kid will wind up with a swollen face and in the hospital. We would recommend it when you can no longer put a filling. We would remove the cavity, clean this area out, and then put a filling here, and then a stainless steel crown. And these are temporary crowns because these baby teeth will be lost usually if it's in a molar at around age 12. If you are an adult, we don't do those unless you want a metal crown, okay? So that is a reason why you would need a pulpotomy when the cavity has reached the nerve and a filling will no longer take care of that problem, that infection, tooth infection. Why do children lose their baby teeth? Well, that's a great question. They lose the baby teeth because you have the upper teeth, the adult teeth coming down and pushing, and as they push, they go ahead and resorb or shrink the root surfaces, okay? So when that happens, the baby teeth loosen and then the adult teeth come in, okay? What should I do if my child chips a tooth? Okay, if your child chips a tooth, give our office a call, okay? So if generally speaking, if it's a little chip or if they chip it fairly big with a baby tooth, you generally leave it alone, okay? But it's case by case. If it's an adult tooth that they chipped, front tooth fractures or chips are very common with children, especially if they have a bite where their upper teeth are sticking out. Just give our office a call because it is case by case. Sometimes you just wait until they're adults and they're done, or they're done with braces. Or if it's really big, we put a white filling material. It just depends. Give our office a call if that happens, okay? What anesthesia options are available for children's dental procedures? Well, basically, obviously, yeah, the shots, right? And there's also topical where you numb the skin. And there's also nitrous, the laughing gas. We do offer that in our practice. I find that a lot of kids really benefit from that. So it really helps, all right? So nitrous topical, meaning the ointment and the usual, I'm going to say the word, it's a shot, yes, but it really depends on how you deliver it to the kid. That creates an experience for the child, okay? Sometimes in advanced cases where there's too much work to do in a child and the child is really little and they're just too little to stay still to be able to do the work, you will have to put the kid under general anesthesia or sedation. That's when they're out and they have the heart monitor, the pulse oximeter, all kinds of stuff. That generally has to be done in a specialized setting, like in a hospital setting, or sometimes in a pediatric practice. But a lot of times they do it in a hospital setting, okay? And that's usually a whole day procedure, like half a day to do all the work and have the kid recover. And so that's intense, all right? The more intense parts are when you have to put them, under general anesthesia or sedation. The simpler cases are when you give them laughing gas and, just a shot here and there. Those are easy, okay? How can I schedule a dental appointment for my child? I just said it. Give my office a call. Let's see what your child has, okay? You go with the piece of the child. The child needs more familiarity with the environment. They got to come in. You got to be patient because once they get familiar and they're comfortable, they're great kids. And they allow you to do the work, okay? And then what happens with a lot of these kids that come in early, you come and bring your child, you practice the preventive dentistry, right diet, bring the kids to their cleaning appointments, you do what we recommend. These children grow up to have really healthy teeth. I have a lot of college-age patients now that don't need anything. They just come in for their cleanings, and it's beautiful to see them with such great healthy teeth. Thanks to you, the parents who took the time, the investment, and the love to bring them here to give them great dental care. All right. If you like the video, go ahead and click, the like button. Go ahead, share for people that you love or could use, take advantage of seeing this video, and subscribe to the channel. I'll see you at your next visit. Bye.